Hello.
Hello, Piotr.
Nice to see you and nice to meet you.
Yes, me too.
So please introduce yourself.
Thank you.
Who are you? What's your background? What do you do?
Okay, so I am Dr. Christophe Panichelli. I am a psychiatrist in near the city of Liège in Belgium. I also have a PhD I defended 5 years ago on the subject of humor in psychotherapy. So I work mostly in private practice with individual clients and also in family therapy. And I use humor as an everyday tool to help my clients to get along with their existential problems.
Mm-hmm. Mm-hmm. Okay, so have you ever met Frank Farrelly in person?
Yes, I met him 3 times in Nijmegen in Holland in 2009, 2010, and 2011, if I am not wrong. It was really very, very powerful experience and very interesting for my everyday practice with my clients, because every time I was there in Nijmegen for the weekend, I asked for have a session with him, and so I experienced Farrelly's techniques from the inside, and it was really a very powerful experience and also very funny.
Yeah. So I was also I am also very fortunate to have met Frank and to learn from him on 3 occasions. So
Good.
I perfectly understand. So for you, what was so magical, so unique about Frank, in your opinion, and his approach?
Well, first of all, it was very funny to talk with him. Humor was really present at every time. From the first sentences you said, he was already saying funny things around the subject. And so that was really, really powerful, because you could directly experience the fact that anything you were talking about, even though this is very serious for you or very painful for you, can be a subject of laughter and of good laughter, because he wasn't joking at you, he was joking at your way of dealing with the problem. So if you can share a laughter about the problem with someone, in this case a therapist, and if you can experience the fact that your problem is not only something you have to whine about or cry about, or so it is not only something that is painful, it also can be something you can laugh about and have positive emotions about. So this is really a very powerful experience in therapy, I think. So that was one of the most interesting points of meeting him, I think.
Yeah, sure. Okay, so can you tell us a bit more about what you do, about your approach to therapy?
Yeah, well, last year I published a book about humor in therapy, which is it is now for the moment only available in French until editors discover its incredible potential for all the languages of the world, you know. But the title is Laughter Therapy, Introducing Humor into Psychotherapy. And so already 15 years ago, before I met Frank Farrelly, I was interested in the subject of humor in psychotherapy, because during my training, nobody had talked about it. A lot of people I met, a lot of doctors I met during my training, and a lot of psychiatrists and psychologists I met after that had a good sense of humor, but nobody ever talked about how you can use humor to help the clients to get along with their problem and to help the clients. So I was interested in that because it was something that felt natural for me, but I was interested in reading something about it, about psychotherapists who experienced it. And so I discovered that a lot of very important and experienced psychotherapists in the world already used it, like Frank Farrelly, but also Alberta Ellis or Paul Václavic or Maurizio Andolfi in Rome, for example. And so I began to specialize myself in the field of how you can use humor. What is a positive way of using humor with the client, and which are also the negative sides of it if you use humor in a bad way. Because, for example, addiction clients often tell jokes about their addiction and to minimize the consequences of their addiction. So you can also use humor to harm the client if you use mockery, but also if you minimize the problem, which is sometimes very serious and very, very bad for them. So my work has focused on the advantages of humor and paying attention to the risks of humor, and with which clients you have to be very careful, in which situation you have to be especially careful, and what are the conditions that have to be present before you use humor with the client.
Okay, so in your opinion, what is the most important thing not to cross this line, of going too far or going into mockery and
yes,
the other bad things?
Yeah, well, the frontier is quite subtle, in fact, but the most important thing goes along with therapeutic alliance. So from the time you have a strong therapeutic alliance with the client, which is to say, from the time the client can feel and know profoundly that you understand him or her, and that you are working for him or her, and that every intervention you are going to try is designed to make him go along with the problem and try new solutions with it, and which Maurizio Andolfi calls the joining operation. It's the moment when you succeed to make the patient feel that you rejoin him in his view of the world. Then if you can keep up with this sensation of joining, and when the client can feel your empathy for him, then you can provoke and use humor in almost every situation. But from the time you lose this joining sensation, then it begins to be dangerous, and every humorous remark can be felt as mockery, even though it would not be the case.
Yeah, so this is the same as in a provocative approach, right?
Yeah. Yes. Right.
We have to have kindness. We have to have this
And
this love and this this certain state in which we are as coaches or therapists. So the client to feel the certain way. Yeah.
Yeah, I think one of the most powerful competences of Frank Farrelly was precisely that. Even though he was talking with somebody very different from him, he had this incredible capacity to make the person feel that he was kind of a friend, that he was respecting, understanding the client, and from this start point, he could say almost anything he wanted, because the people could feel really that he was respecting them and very sympathetic with them.
Yeah, exactly. Okay, and since when people start to learn provocative way of working with people, of approaching therapeutic or coaching work, they are very often afraid of going too far, afraid of being too provocative, afraid of using humor. So, what would you say to those people that are afraid of using humor in therapeutic work?
Well, I would say in the case of humor phobias, and you have to be very attentive, because this is a psychiatrist speaking and with a PhD, so this is going to be very important. That in the case of humor phobia, you just have to do one thing: you have to lock yourself up in the toilets and wait there until the phobia is cured. Because if you come out of the toilets because before it is cured, all the humor molecules inside your brain are going to begin to vibrate very intensely, and it could make your brain explode. So it would be very, very dangerous. So in the case of humor phobias, you have to be really very careful.
Yeah, yeah.
But maybe maybe more seriously, I would say this is a very important question, because, and very natural one, because once you begin to use provocative interventions, and once you begin to use humor with the clients are going to respond very much harder and very much intensively with intense emotions than if you have a normal conversation. So it can make people afraid. When you're a therapist and you begin to provoke the patient, the client are going to respond very hard. So the first times it can be quite impressive. Part of the training is to get used to that and to continue to focus on what the client is saying and how he says it, and on what are the clues to the dilemma of the client, even though he's responding very intensively.
Yeah.
And this is somewhat distracting, because you try something and you're humorous or provocative, and you feel a little cautious about it, and then the client is going to respond very hard, and then you get distracted by this very hard reaction. But at that time, you don't have to get distracted. You have to continue to focus on what problem is the client bringing to me, and how can something move about it.
Yeah, yeah, yeah. I totally agree. Okay.
Thank you. Even on the homophobia part.
Yeah.
I wondered.
Okay, so we touched the phobias subject. So let's go deeper into
Let's dig deeper.
Quite heavy stuff, because do you think that working using humor and provocative approach, is it possible with people that are depressed or terminally ill or have suicidal tendencies? What's your take?
Well, I would say that in those very bad and hard situations, humor is even more necessary, in fact, because all those clients are desperately in need of feeling something positive about their lives. They have to continue to feel that the life is worth it, and that you can get some good out of it. And if those very serious patients can feel that inside a session with a therapist, then they go out of your room with something positive inside their hearts, because they have again felt something positive about it. It goes along with the subject we were talking about in the beginning of our discussion, is that most of the time the clients come along with a presenting problem, and they only have negative feelings about it. And when they discover with a therapist or with anybody else that they can laugh about it, and that they can feel good while talking about this very hard problem with someone, if they can feel something positive at the same time they're talking about a very serious problem for which they don't have a solution for now, if they can feel these positive feelings, then they can restore hope. And this is part of the process of therapy. If you can feel hope about it, then you are encouraged to change something in your behavior, to manage it differently. So I would say that in those very serious situations, humor is really necessary. It made me think about a film that you maybe know, which is called The Bucket List. With Morgan Freeman and Jack Nicholson.
Yeah, I haven't seen it yet.
It's a really very good film. These are two very old people who meet in the hospital because they have cancer and they can't get cured, so they are terminally ill, and they decide together to make a list of all the things they still want to do in their lives before they die. So they make a list. It goes along. For example, they want to make a parachute from a plane, and all things like that that are a little extraordinary. And all those positive experiences make them feel that life is worth it, even though they are dying, or maybe they will be dead next month or next week. And it's a very powerful film and very beautiful to look at, that it tells you something as a human being, that even though maybe life is finished next week, you can have fun and you can be happy. You can say important things to the people you love, and you can have very good and funny moments, even though you're very sick, for example.
Mm-hmm. Okay, and by the way, do you have some other films that you could recommend about using humor to in a therapeutic context, or just to evoke change in people, like positive change?
Wow. Well, probably I could give a very long list, because very good films often go about this kind of subject, this kind of human feeling that life is worth it. So, but about humor, of course, there is the film of Patch Adams, you probably know, which is interesting. I can't think of another one like this, but it would maybe come up in the conversation.
Okay, so let's go right now into your lecture
Yeah.
during the conference, because the subject is very interesting.
Thank you.
So please tell us more about this.
So I chose to talk to you about humorous, provocative songs, which is kind of a meeting of Frank Farrelly and Alberta Ellis. So you already know about Frank Farrelly, which is the founder of provocative therapy. Some years before Frank Farrelly, when maybe 10 years before he published his book, Alberta Ellis founded rational emotive therapy, and which in part inspired Frank Farrelly, because he writes about it in his book. And Albert Ellis developed rational emotive therapy, in which he sometimes used famous songs which he rewrote. He rewrote the lyrics of the song to about the subject of a patient that was coming to his consultations. And so he wrote very funny songs to help the clients laugh about their problems and relativize their absolutist beliefs, for example, and help them to cure their problems. And when there was the COVID epidemic, there was a time where I wasn't allowed to see my patients anymore. And at that time, I was reading this article of Albert Ellis and his humorous songs again. And I said, well, now I am using humor with my clients. I'm going to try this for once. And so I wrote a little song for a client. And the effect was really astonishing, because this client was suddenly thinking about her problem in a very intense way. She came back to the next session having written me 10 pages about it, because it was really boiling in her brain. So I discovered this is a very interesting way of dealing with the problem, and of making an astonishing intervention, and then let the client begin to think in another way about their problems. So it will be illustrated by two clinical examples where I will take my guitar and give the best out of it.
Oh, wonderful! I can't wait.
Uh, I hope it will be all right, because this is kind of a difficult exercise, because I wrote all these songs in French for my clients here in Belgium. So to traduce this in English is some kind of a difficult exercise, but I hope it will be understandable and that the humor will come out of it too.
Yeah, so you have a challenge.
Yeah, it's a challenge, really. It's always a challenge when you dare to present this to the client, because you don't know how they're going to react. And last time I did it, last week, for example, I was looking at the client while I was singing, and I was thinking, well, it doesn't seem he thinks it's very funny. He was not laughing. And so I asked him at the end of the song, and he told me, well, we're really concentrated to understand if you what was your state of mind writing this for me? And he was really moved by the fact I had taken time to think about his problem when he wasn't there. And so when he got out of my room, he said, "Really, thank you for having done this for him." So it's like we were talking earlier. Also, the client's reactions are often complex, and they can, for example, if a client laughs about something, it's not only laughing. Probably he's understanding very important things about his situation, and it's not only funny. It's also very serious. And in the case of this client, he wasn't laughing, but there were really a lot of things going on in his mind while listening to him, and a lot of times there is a lot of positive emotion, of deep emotion, of feeling understood and feeling rejoined by the therapist.
Okay, and then when you do such a thing that is also new for you, right? And you're not maybe quite sure about the effect.
Yeah.
I guess your state as a therapist is crucial, right?
Yeah.
Like not to lose track, not to get distracted, and remain focused on the client and on
Yes.
what you do, yeah. So
This is one of the risks of humor. In fact, every time you use humor, you can get distracted by your own positive feelings of finding this sentence particularly funny. And if you get lost the track of what does the client think about it, what is the problem of the client, then you can get distracted by your own feelings. And that's the work of the therapist, to be conscient about your own feelings and to use them in a positive way, but never lose the track of where the patient stands with his problem and how he feels about the conversation that is going on. So you have to have a neuron that is always locked up about the client and looking how he's experiencing the situation. That's your work as a therapist. That's the challenging part of the work. In fact, that's what makes our work as therapists interesting, I think.
Mm-hmm.
Especially if you use provocative interventions.
Yeah. Okay. So right now, if there is anything that you want to say to the Polish people before the conference.
Well, maybe I thought that, of course, if you suffer from homophobia, probably you can't come to the Congress, because if you have followed my advice earlier, you are already locked up in the toilets. So this is too bad for you. But if you don't suffer from homophobia, just come along and it will be a great time, probably.
Okay. And right now, just a quick one, like your personal invitation for your workshop, for your lecture during the Congress. Okay.
Yeah, okay. Well, if you like provocative interventions, if you like humor, if you like to sing, then come and mix all those ingredients together and come to listen to my presentation, with is entitled Humorous Provocative Songs, the meeting of Frank Farrelly and Alberta Ellis. And welcome, of course.
Okay, Christophe, am I pronouncing your name correctly?
Yeah, that's right. That's right.
Okay, Christophe. So thank you very much. It was really nice talking to you,
My pleasure.
and I'm personally looking forward to your presentation.
Thank you. Thank you. Can you tell me if all this will be online somewhere or when?
I guess so. This will do in Polish and probably English subtitles. We'll add
Okay.
English subtitles, and it will be published on social media and on this Provokare Foundation.
Okay.
You're okay with that?
Yeah, of course. Would it be possible to send me the files
Yeah.
of the?
Yeah, sure.
Yes.
Yes.
Thank you.
Yes, I will download the file because it is recorded in the cloud, so there is no problem with that, and I will send it to you. I cannot tell you exactly when the material will be published because usually we need, some time for subtitles preparation and
Yes.
edition of the video, because sometimes we cut it into shorter forms, and we need also to cut the invitation from the interview, etc. But yeah, we will let you know.
Super. Thank you.
Okay.
So,
So, Christophe, thanks again. It was
Thanks you.
very interesting